the entire fabric of the organization, beginning with stronger national capacities and improved international cooperation, as Princess Muna said earlier. One idea proposed last year by the Central African Republic and Benin as chair of the African Union then is a system in which countries agree to a regular and transparent process of peer review, similar to the system of universal periodic review used by the Human Rights Council. We're calling it the Universal Health and Preparedness Review. Its purpose is to build mutual trust and accountability for health by bringing nations together as neighbors to support a whole-of-government approach to strengthening national capacities for pandemic preparedness, universal health coverage, and healthier populations. We are now in the process of developing a more detailed proposal, which we will share with member states very shortly. Since I mentioned the concept in my address to this assembly in May, Cameroon, the Central African Republic, France, and Germany have expressed interest in the idea and have agreed to work with the Secretariat in the startup phase to develop and pilot the mechanism. We welcome any other member state interested in participating in this pilot phase, and we look forward to discussing this idea further with member states in the coming weeks and months. My sisters, brothers, and friends, this will not be the last global health crisis. When the next one arrives, will the headlines be the same? Will they say that after the COVID-19 pandemic, the world wrung its hands, wrote reports, and changed nothing? Or will they say that COVID-19 was a turning point for global health security and for global health? This is our opportunity to write that story now. A vaccine is needed urgently to control the pandemic. But, as you know, it will not fix the vulnerabilities at its roots. A vaccine cannot address the global underinvestment in essential public health functions and resilient health systems, nor the urgent need for a One Health approach that encompasses the health of humans, animals, and the planet we share. There is no vaccine for poverty, hunger, climate change, or inequality. None of these challenges can be addressed in isolation. They're deeply intertwined, and so must be our response. In 2015, the world came together to adopt the Sustainable Development Goals, the Paris Agreement, and the Addis Ababa Action Agenda on Finance for Development, which I had the honor to chair. It was a moment of great convergence, the nations of the world uniting for a common purpose and a common future. Since then, since 2015, the creeping tides of misguided nationalism and isolationism have eroded that sense of common purpose. The Paris Agreement has been undermined. The commitments made in the Addis Ababa Action Agenda have gone largely unfulfilled. And although there has been progress toward the SDGs, too often our efforts have remained siloed and splintered. We were already off track to achieve the SDGs before the pandemic. Now we are even further behind. But far from abandoning them, the pandemic has shown why the SDGs, with their sweeping vision for people, planet, prosperity, peace, and partnership, are so important and must remain our guide now and in the post-COVID world. However, we must be honest. We can only realize the full power and potential of the SDGs if the international community urgently recaptures the sense of common purpose that gave birth to them. In that spirit, we congratulate President-elect Joe Biden and Vice President-elect Kamala Harris, and we look forward to working with his administration very closely. We need to reimagine leadership built on mutual trust and mutual accountability to end the pandemic and address the fundamental inequalities that lie at the root of so many of the world's problems. We need to reimagine investments in our shared future by allocating and aligning resources with our shared priorities. And we need to reimagine partnership, tear down our silos, and see our own efforts as connected to something bigger. It's time for the world to heal from the ravages of this pandemic and the geopolitical divisions that only drive us further into the chasm of unhealthier, unsafer, and unfairer future. It's time to forge a new era of cooperation that puts health and well-being at the center of our common future. The world has reached a fork in the road. We cannot afford to pump carbon dioxide into the atmosphere at the same rate and still breathe clean air. We must choose. We cannot afford ever deepening inequalities and expect continued peace and prosperity. We must choose. And we cannot afford to see health merely as a byproduct of development or a commodity that only the rich can afford. We must see it for what it is, a fundamental human right that underpins every human aspiration. Today and every day, we must choose health. We're one family. We're one big family. The rule of the game is cooperation, solidarity, compassion, peace. Thank you so much.